Hello and welcome. Today, we're diving into a relatively rare, but potentially serious condition affecting the kidney's renal artery dissection. We'll explore what it is, what causes it, how it's diagnosed and treated, and what the outlook is for those affected. So, let's get started. So, what exactly causes a renal artery dissection? The causes can be broadly categorized into spontaneous and traumatic. Spontaneous dissections, meaning they occur without any obvious external injury, are often linked to underlying conditions that weaken the artery walls. These include fibromuscular dysplasia, a condition affecting the structure of artery walls, atherosclerosis, the buildup of plaque in the arteries, connective tissue disorders like Marfan syndrome or Ehlers-Danlos syndrome, which affect the body's connective tissues, and pregnancy, which can cause hormonal and physiological changes that increase the risk. Traumatic dissections, on the other hand, occur as a result of a direct blow to the abdomen or flank, a rapid deceleration injury, or even during certain medical procedures like renal angiography. Understanding the cause is crucial for managing and preventing future occurrences. Now, let's talk about pathophysiology, how the disease actually develops and affects the body. In a renal artery dissection, a tear develops in the inner layer of the artery wall. Blood then surges through this tear and accumulates between the layers, creating a false lumen, essentially a pocket of blood within the artery wall. This false lumen can compress the true lumen, the actual channel through which blood flows, restricting blood supply to the kidney. The reduced blood flow can lead to kidney damage, including ischemia or lack of oxygen, and potentially kidney infarction, which is tissue death due to lack of blood supply. The dissection can also extend into other arteries, further compromising blood flow. In some cases, the dissection can cause an aneurysm, a bulge in the artery wall, which can rupture and lead to life-threatening bleeding. Renal artery dissection is a relatively uncommon condition, making precise epidemiological data somewhat limited. However, it's estimated to occur more frequently in younger and middle-aged adults, particularly women with fibromuscular dysplasia. The overall incidence is thought to be quite low, but it's likely underdiagnosed, as many cases may be asymptomatic or present with non-specific symptoms. Research is ongoing to better understand the true prevalence and risk factors associated with this condition. The signs and symptoms of renal artery dissection can vary greatly depending on the severity and extent of the dissection. Some individuals may experience no symptoms at all, particularly if the dissection is small and doesn't significantly restrict blood flow. When symptoms do occur, they can include sudden onset of flank or abdominal pain, often described as severe and sharp. Other possible symptoms include high blood pressure, nausea, vomiting, blood in the urine, and decreased kidney function, which can manifest as reduced urine output or swelling in the legs and ankles. In severe cases, the dissection can lead to kidney failure. Because these symptoms can mimic other conditions, it's essential to seek prompt medical attention if you experience any of them, especially if you have a history of risk factors like fibromuscular dysplasia or a recent abdominal injury. Diagnosing renal artery dissection requires a combination of imaging techniques. The gold standard is often a CT angiography, or CTA, which uses a CT scan and contrast dye to visualize the renal arteries and identify any tears or abnormalities in the artery wall. Other imaging options include magnetic resonance angiography, or MRA, which uses magnetic fields and radio waves to create detailed images of the arteries, and renal arteriography, an invasive procedure where a catheter is inserted into an artery and dye is injected to visualize the renal arteries. Ultrasound can also be used as an initial screening tool, but it's less sensitive than CTA or MRA. In addition to imaging, blood tests are typically performed to assess kidney function and rule out other potential causes of the symptoms. While there isn't a universally accepted classification system for renal artery dissections, they can be broadly categorized based on their cause, extent, and the presence of complications. As we discussed earlier, they can be classified as spontaneous or traumatic. Furthermore, the extent of the dissection can be described as localized or extensive, depending on how much of the renal artery is affected. Finally, dissections can be classified based on the presence of complications, such as kidney infarction, aneurysm formation, or rupture. This categorization helps guide treatment decisions and predict the prognosis. Treatment for renal artery dissection depends on the severity of the dissection, the presence of symptoms, and the overall health of the patient. In some cases, particularly if the dissection is small and there are no significant symptoms, conservative management with blood pressure control and pain medication may be sufficient. However, more severe cases often require intervention. Endovascular treatment, such as stenting, involves inserting a catheter into the artery and placing a stent, a small mesh tube, to support the artery wall and restore blood flow. In some cases, open surgical repair may be necessary to repair the damaged artery. Anticoagulant or antiplatelet medications are often prescribed to prevent blood clots from forming in the affected artery. Long-term follow-up is essential to monitor kidney function and prevent recurrence. Preventing renal artery dissection can be challenging, particularly in cases of spontaneous dissection. However, individuals with known risk factors, such as fibromuscular dysplasia or connective tissue disorders, should work closely with their healthcare providers to manage their conditions and minimize their risk. This may involve lifestyle modifications, such as controlling blood pressure, avoiding smoking, and maintaining a healthy weight. In cases of traumatic dissection, protective measures such as wearing seatbelts in vehicles and avoiding activities that could lead to abdominal trauma can help reduce the risk. The prognosis for renal artery dissection varies depending on the severity of the dissection, the promptness of diagnosis and treatment, and the presence of underlying medical conditions. With timely diagnosis and appropriate treatment, many individuals can recover and maintain good kidney function. However, delayed diagnosis or severe dissections can lead to kidney damage or failure. Recent research is focused on developing more effective diagnostic tools and treatment strategies for renal artery dissection. Specifically, researchers are investigating the role of genetic factors in predisposing individuals to spontaneous dissections and exploring the use of minimally invasive techniques to repair damaged arteries. Ongoing research is also aimed at identifying biomarkers that can help predict the risk of recurrence and guide long-term management.